Scientists are closely following COVID-19's new subvariant, nicknamed the stealth Omicron variant. The BA.2 strain could drag out the Omicron surge worldwide. Early research says it's more contagious, but it doesn't appear to cause more severe disease. In Denmark, it already makes up 65% of new cases. Here in the U.S., it's expected to cause a slight hitch in the downward trend of cases. Joining us now to talk about this subvariant and more is CEO and Medical Director at HFit Health, Dr. Anthony Harris. Nice to have you as always. Welcome back to the show.
Hey, thank you so much, Ruta Bay. Thanks for having me.
So let's first talk about the BA.2, aka the stealth Omicron variant, potentially even more contagious than the original Omicron variant we know about. What should we know about it?
That's exactly it. Based upon what we're seeing now in Denmark and Sweden, it looks like this Omicron variant, BA.2, which was found roughly at the same time as the emergence of the original Omicron strain, BA.1, is about 1.5 times more contagious than its, more prevalent at this point in time, BA.1. So what does that mean? That means that the tail that we're seeing fall off from in the U.S. here may not last very long. If we look back to Denmark, what happened, it didn't last very long before they had an acceleration, doubling the number of cases. There are over 7,000 new cases on a daily basis per million individuals. That's a far cry away from where they were before BA.1 hit back in December. So it looks like we're going to have a rough ride potentially in the weeks to come.
And this is harder to detect potentially, if I can talk, but it will still show up on PCR tests for those who have it, right?
That's correct. What we're seeing is that BA.2, unlike its predecessor or its more prevalent BA.1, doesn't have the quintessential what's called dropout, gene dropout, meaning that when you test for most PCR tests, you have three genes that you're looking for, three locations, if you would, in the spike protein. And one of them usually falls away when we're talking about identifying Omicron. And that does not, unfortunately, seem to be the case with BA.2. And so the PCR picking up Omicron or suspicion for Omicron is not as telltale as it was with BA.1, which might pose some problems for us in terms of really understanding how prevalent BA.2 is here in the U.S. That's already been detected in multiple states.
And we're now able to order our at-home tests from the federal government. That was seen as a big step forward in the fight against COVID, because if you can identify it, hopefully you can isolate it and stop the spread. But you say there may be unintended consequences, right? Explain.
There may be. And so let's focus on two potential unintended consequences from the, getting tests in the hands of Americans. Now, I want to make it clear, we want people to have tests, we want people to test, but we want to emphasize, and this is why I'm pointing this out, the proper way to test. So when should we test? Most people, gut reaction, this is anecdotal and as well as what we're seeing in our practice nationwide, is that when somebody becomes ill, the first thing they do and think of is, I'm going to go test. And now that we have access to tests, they're going to do that usually on day one of their symptoms. But that's not when we should test, because we know two things, that these rapid tests are less accurate. In some cases, only 50% is accurate as PCR gold standards. And the second thing is that we're seeing individuals becoming actually positive from a rapid 3 days after onset of their symptoms. And so if you test on day one and you're negative, you can't assume that you don't have COVID. So don't go hang out with grandma or hang out with relatives that may potentially be immunocompromised at risk for severe illness from COVID. You need to make sure that when you're testing, you're going to test at least on day 3, or at least have 2 tests that show that you're negative for Omicron or COVID-19 before you're around others that may be vulnerable.
Yeah, that false sense of security, we have to look out for that. Previous attempts were expired or struck down in court. Now, OSHA is coming up with new COVID rules for healthcare facilities. But as we've seen, this can take months or years. This would likely include masks, cleanings, notifications to workers who are exposed. What should we know about that?
Sure. So we know that OSHA has, on the 26th of January, retired their effort for the ETS, the emergency standard that we all became familiar with. But what they did not do is leave behind the rulemaking. And so they're going to push forward. And like you said, that process can take 12 months to 24 months or longer. However, it still may signal that that U.S. businesses, small business included, may have to adhere to standards to be compliant with law, with legislation. We know, and we still see that WHO estimates we'll be dealing with COVID for 5 years total from the beginning of the pandemic. We're only about 2 years in, approximately, right? So we got 3 years to go, and this rulemaking may be law well before then, and that's going to impact businesses left and right. Look, the seropositivity for the U.S. Is the second unintended consequence that we want to mention real quick. It's estimated that 67% of Americans have been already infected, CDC data, from COVID-19, but we only have 74% that we've documented actually reported to CDC, and it's going to go lower now that we have hands on tests that are not being reported to agencies. So we're grossly underestimating the number of people infected. Gottlieb says at least half of the U.S. will be infected from Omicron by itself. So we need to watch for that. And certainly businesses will be impacted in terms of keeping workers at work safely.
All right, that is a huge number. Dr. Harris, thank you for joining us tonight. Appreciate it.
Thank you.
Thanks for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.